So basically, uh, we are talking three things together: epidemiology, biostatistics, and research method. So epidemiology, as we discussed previously, concerned with the health-related problems or health-related events that we are studying in terms of the distribution and determines. There's a time, place, and person, and why and how. So, and this is the basics for the public health practices. And nowadays, for progressing even in the clinical side, we require the epidemiology. And it provides the basis of understanding of any disease or understanding of any health event. So, suppose you want to study epidemiology of dengue, COVID-19 for any disease. First, you need to find out in terms of time trends, in terms of place of person who are affected, all those things you need to describe. And one of the best thing to understand the epidemiology, you should involve the people themselves. And let's say 3, 4 decades ago, if you are going to do, then a lot of people you will find illiterate, they can't understand. But in that case, you need to ask and write down, etc., etc. Nowadays, it is possible that you have a Google form for collection, you have the various the survey methods, etc. You can develop a platform whereby people can give you the inputs every day or every weekly, like that. So now it's relatively easier to collect the data, to analyze the data, etc. But in any case, verification, you have to do it if you want to exactly calculate the rates, ratio, etc. Other question could be, how many new cases of whooping cough were reported among teenagers in Canada last year? This is one question of the Canadian things. In our case, we can say that how many cases are occurring in Rajasthan of heat stroke, you can say. So in this case, the words incidence and prevalence looks very simple, but they are not that simple. Incidence is out of at-risk population, while prevalence is out of total population. So when you say that new cases is incidence and old case plus new cases are prevalence is not that simple. In that case, incidence you can take out of at-risk population. That is very important, and this is a usual mistake people do it. Now, the how the word epidemiology came. Epi means upon, demos means people. So study of people, or you can say logos, logi is a science. So basically, epidemiology means we are working with the people, working with the community. And in that, your purpose is to study the population in terms of a particular event or particular disease. And that you are going into details. In classically, when we were talking about the epidemiology, we were talking about the human population, communities, etc. We were using more in the public health, but nowadays we are using in clinical epidemiology also, including you can say the dentistry, you can say the orthopedic, you can say the ophthalmology, etc., etc. The ideal would be if we combine the hospital clinical epidemiology as well as the community-based epidemiology, the connecting line is referral system. And if we have a strong referral system, then probably we'll be able to combine this thing. I will give an example. A family adoption system in the India imposed by NMC. In that, 5 families are to be adopted by each medical students. So let's say we have around uh, 50,000 medical students across the India, or 1 lakh medical students across the India. And we are choosing 5 families. That means 5 lakh families. That means the population, 20 lakh population. If this 20 lakh population, you are following up in the community, and whenever they come to the hospital, if you go in details of their clinical aspects and combine the population-based epidemiology and clinical epidemiology together, then the picture will be clear. What happened in the hospital, what happened to the community, whether the patient consumed the treatment or not, or whether the patient was taking other treatment also together, like that. Within hospital, you won't be able to study all the details. In the community also, all details you will not have. So if this students, medical students, does a very good survey together, then we'll have a complete picture, complete epidemiological picture. Certain terms identify the risk factors, why the disease occurs, why few people are not affected by a particular disease. It is as important as why people are affected by disease, why people are not affected by disease. That also we need to understand. When you find out the risk factor, then the cause also we should be able to find out. There's a difference between cause and risk factor. Risk factor predisposes a person. For example, you are having vitamin A deficiency and then you are having infection. So vitamin A deficiency is a risk factor, but the infectious agent is a causal factor. Then why you are using the epidemiology to evaluate? You are giving a various treatment, or at a community level you are using various strategy, and to find out whether that is acting properly or not. Over a period of time, you can compare the incidence in case of the in acute diseases, and in case of chronic diseases, you compare the prevalences. Now, explain the natural history of disease. Now, natural history of disease nowadays is very, very difficult, because the moment symptoms start, people start taking treatment. So it's very difficult to explain the natural history of disease. But then, even with the tablet or intervention, they are doing it. If you study 1,000 or 2,000 cases, then probably you can match the points and can find out the natural history of disease. I will give an example. A person is suffering from fever. Will come to the doctor, say, just 2 hours back, I have a fever. And before you describe various stages, etc., is only 2 hours history. So what to do about this? And that's also, the patient might have taken a paracetamol tablet even after 1 hour. So there is some background fever coming up. You need to measure the what type of fever, when the tablet was taken. Everything we need to put together. We may not be able to see the classical pattern of typhoid and classical pattern of malaria right now. So we need to see the background history of treatment also, and then we need to evaluate what kind of natural history it would be. Then the people may say that, what is the risk that I will have this disease? If you are working in the mines, if you are working in a particular occupation, like say the business worker in the cotton industry, or you are having the road traffic police. For all the occupations, what are the risks that that person will suffer from this? Or what will be the risk of dying for a mother who becomes pregnant in, let's say, India? What is the risk versus the risk in USA? That risk estimation can also be possible. Then come about complete the clinical picture of disease for healthcare practitioner. Now you have given B12 injection for few people, others you have given B12 tablets. What is the difference between these two? B12 tablets and this. So clinically patient was having a certain symptoms. Based on that, you have treated with the tablets or other things. What is the outcome? So it may be possible that patient may not turn up back. So if you have the data, field-based data also, then probably in the both the case you will be able to complete the clinical picture. Then comes epidemic investigation. In this, there are outbreaks, cholera outbreaks, or the diarrhea outbreaks, or fever outbreaks, etc. In that case, epidemiology will be useful to investigate the outbreaks. Now, in case of, let's say, we want to compare the various pathies and various treatments together. In case, let's say, I want to study the Ayush and the allopathies together, and then I can randomize the people that you go for the Ayurvedic treatment, you go for the allopathic, you go for the homeopathic treatment. At that time, first stage of any research or any kind of the epidemiology will be what it is as it is you need to study. Of course, if patient is dying, you can't allow the patient to die. But then whatever pathis are doing, whatever they are doing, just observe what is going on. In that is the observational research or observational epidemiology. In experimental research or experimental epidemiology, you are giving some treatment to some group, other group you are not giving. At that kind of thing you are doing is experimental research. In observational study, we divide into two parts: case control study and cohort study. Experimental epidemiology, you have the further the analytical points you are going to make. So the experimental study, one of the classical would be the randomized control trial. In one group you do it, second group you don't do it after randomization. In descriptive study, you have a population-based data. In particular community, there are 3%, 4%, 5%. So time, place, person, this three characteristic is considered under the descriptive studies. In analytical studies, you are doing analysis. For example, the relative risk, odds ratio, attributable risk, all this you are finding out in analytical studies. So, this is just to summarize the thing. One side you have descriptive study, you have one side analytical study. In analysis study, you have observational study, like course study, cross-sectional studies, case control studies like this. In experimental studies, you are randomizing the group, or it may be the natural randomization or maybe the artificial randomization. And the best thing would be crossover. Initially, you have two groups, you treat one group, keep control other group. But then after 6 months, you the crossover the things so that all the characteristic you can consider similar. So there are various studies design are there. One of the thing is qualitative research and quantitative research. In qualitative studies, we are describing the details, even individual case histories, etc. You're going to take, and in a quantitative study, you are developing that what is the difference between these two groups, what could be the association level, could it be causation or not. There's a series of tests which you can conduct. So when you want to say which kind of study I would require, so we can summarize that. For a very initial phase, you go for observation study. And then if you want to proceed your hypothesis, you go for the experimental studies. Generally, what we do that initially we go for the case control studies, and then we go for cohort study. And then once we want to make the thing powerful, then we go for randomized control study. Meanwhile, if you have any question, we can attend that. We
Hello,
just
sir.
discuss a bit about. the epidemiology part or something on the research. And then we'll be combining the things together. Now, in medical research, if you want to do any research, you should have a knowledge of epidemiology and biostatistics. If you apply this together, research will be much easier. So, why are we going to do research? Of course, you have some problem to solve it, and then when you do some new research or if you find out a solution, you have excitement. Yes, I want to do it. For example, we have found out a very good solution for vitamin A deficit detection. We are very eager to reach to the people. A few people do for the sake of prestige. Yes, I have some name. Or sometimes people have a passion. No, I want to do something for the country. The difference between USA and uh, the our India, usually the Western countries, they take one point and they dig into much detail that area for lives together. And that's why there are a lot of research in that and the publishing also uh, in that country. While in India, we people are more spiritual and we think in terms of holistic and we try to relate each other, but don't go into depth of one thing. So if you combine the Eastern and Western philosophy together, scientific and spirituality more together, will have much better results. And sometimes you publish the papers and get recognition for promotion. Also, people do the research. And if we do some kind of research, see, I will tell you that as a part of this study, you start thinking of the various research topics. The best thing to find out the various research topic, make a group of 10 people, with students or teachers, write down the list of problems which comes to your mind. Whatever problems comes to your mind, just write down the list of problems. And then find out which problem you can solve, which is feasible to solve in a particular period, time period. Then from that you will be able to do the research for the purpose of learning, but for the purpose of real life situation, even the problem is too big, you should be taking as a challenge. And when we are doing the research, we should look at the research paper from critical point of what is wrong with this research paper. That we should try to have a critical attitude, not only for others as well as for self analysis also. And as a part of research, we are studying the subject in depth. I will give an example that generally we talk about the traditional pattern, how they are doing, etc. But when you go into depth, we can find out no, there are something which is good among them also. When you go into depth, you have a chance under this research. Then nowadays people don't go to the library, but at least online resources you have. You study the thing into detail. When you want to just talk about vitamin B12, one fellow was giving injection B12 to so many people, and people used to come frequently to that person. But now, if the same doctor studies in goes the library and says that no, only injection of B12 are useful, is not like that. Even oral B12 is also effective because most of the time now there is a myth among the doctors also. Most of the doctors they don't agree. No, B12 can't work orally. But if they read in the paper, then probably they'll find yeah, it's possible. And then the it acquires a special skills and interests. For example, how to calculate special the sample size, how much sample, what kind of sample size, how the sample size to be determined, what kind of various the methods are there, what should be the sampling technique, how to prepare the sampling frame. I will give an example. If you have 1 lakh population, you don't have a census data with you, you don't have the ICDs register with you. How are you going to make a sampling frame? If you make a sampling from for 1 lakh population, it will be too difficult. And the sampling size and the sampling technique will be based on first step is to make a sampling frame. So in such case, how to do it, that's research skill you will find out that the estimate can be done, how to find a center point of the committee, etc. And if you are going to do a multi-centric research study, etc., you will have friends and also the wisdom you can exchange with each other. So we hope that in this, before we the end on the 15th August, at least one the multi-centric research study will be able to take it. And of course, for promotion also, you need to have a 2 to 4 research the projects or research papers published in the national and international journals. Now, when we are doing the scientific research, it's not a mere accumulation of the data. You have, let's say, 10,000 data of 10,000 pregnant women. You have that in the computer collected in the survey service data. You may not be able to find out exactly what you want out of that. But before you start collecting the data, if you have systematized that these are the field which is key field and which you have to fill it up, if you have designed something that even the in-service data will also be able to give you the research. If in your hospital, if you decide that these are the research which we want to conduct based on our day-to-day data, then if your the HMIS, Hospital Management Information System, is good enough, then you can take out many research topics out of that. And if you are doing research, then your staff will also be very meticulous in collection of the data, and also you will be cross-checking the data, so that will be much better. Otherwise, if there is for example, there is a milk 100 liter, and on a one drop of poison can spoil all the milk. Similarly, you have collected a lot of data, but few people have not collected wisely, then it can spoil the data. So while data cleaning process, you should be able to find out what are the points which you should consider. You can say the outliers. Say age is 160 years, or you are doing a study in the school, and age return is 3 months. These are the outliers, and that can spoil your data. So you need to do the data cleaning. And nowadays, data validation process, if you apply in case of AP info collecting forms, or even in case of a Google form, etc., that will be much better. And as a part of research, your observation and facts, you are just segregating and making a meaningful the interpretation out of that. And based on that, you may be able to formulate new theories, etc. People say that the usually the malnutrition is because of lack of food, or because of inaccessibility of the love and affection, etc. But there can be a small boil on a scalp which may lead to malnutrition. So, thorough examination of all the possible factors, and from that, finding out the best possible with a good interpretation uh, that you can do under the scientific uh, analysis. In this case, you can have observation, logical reasoning with why this happens, how this can happen. See, when the COVID started, people were scaring, even touching the files, touching the pen, etc. It's a fast moving the disease. And how come this format can be so useful in, or so meaningful in transmit the disease? At that time, if we must have a logical thinking, we would not have afraid so much of the COVID-19. Then comes the we need to formulate the hypothesis how it can explain this, that we should be able to do it, and predict other possibilities. Not only that is it could be airborne, it could be waterborne, it could be this one, etc. And then based on our factors and analysis, we should be pinpoint, yes, these are the possible And then by doing a various experiment, observational or the real experiment, in case of disease, it is very, very difficult that you impose certain thing and produce a disease. Of course, animal studies you can do it, but in human being you can't do it. So in that case, you need to do the observational data only, and based on that, you need to find out the probabilities. So we need to ultimately find out the truth. Now, when the professional is a one thing, an intentional problem is another thing. Most of the time, there is a conflict of interest nowadays when it goes to the randomized control trial for the medicines. And it is very, very difficult for ethics committee and scientific research committee to scrutinize the implementation of the randomized control trial for newer molecules. So we should be careful while going for that. In this case, the I will give an example. Um, Suppose newer molecule A, the company claims that it is costing much less, is only 10 rupees, and still it is equally effective. There is no significant difference between drug A and drug B. Drug B is costing 1,000 rupees per tablet. Drug A is costing only 10 rupees per tablet. And between two molecules, there is no significant difference. If there is no significant difference, would you say that the newer molecule is equally effective? So write down in chat box. I repeat, so that this is very interesting. This molecule A rupees 10 and newer molecule, and molecule B is rupees 1,000, and company found that there is no significant difference between these two molecules. It says that alpha error 5%. Because 5% will be there 95% time. It is like this. So what happens in most of the time, because clinicians don't understand about various kinds of error, etc., they will go for this. Now, what do you think? The molecule A is better or not? What do you use? Molecule A or B? You will continue to use B. You will be using A, new molecule. Anyone else? What people are going to use, A or B? Okay. So let me tell you that in this case, company has talked about alpha error. They have not talked about beta error. This is why statisticians should look into the matter. See, when you have a very smaller sample size, let's say you have only 2020 sample, and you are going to compare, you may not find the difference significant. But at the time, you should be looking into the beta error also. And usually people miss, they don't look at the beta error and then accept the yes, only a sample of 20 units taken and says that no significant difference. But no significant difference could be because of very small sample size in which beta error is much higher. So as a statistician, you should go into DAP and look at the matter in detail. Don't look at only at the alpha error. Look at the beta error also. And that's why in the complex, the calculation power of the study is also considered. Power of the study is 1 minus beta error. So usually beta error you can take 10%, 20%, then the power of study is 80% or 90%. That's more the power, lesser the beta error, more the power. So when we look at the standard normal distribution curve, we'll be talking about what is alpha error, what is beta error. So if you want to find out the truth, you should do the observation first give a reasoning, and if possible, then you can do the experimentation also. So you need to apply logic also, and you need to observe also. Only logic or only observation will not be possible, will not give you the right thing. Now, these two words, inductive and deductive reasoning, when you are doing your research study, try to understand both these words, inductive reasoning and deductive reasoning. Now, inductive reasoning from the specific to the general. And we make observation, perceive a pattern, and then do the generalizations. From specific to generalization, you are going in inductive reasoning. You have seen some specific things. Based on that, you arrive at the general points. For example, and in deductive, you have a some theory, and based on that, then do the predictions, and then you go for the particulars from general to specific. So in inductive, from observation, and then you go for the theory or generalization. And in deductive, from theory, you go for the observation and then confirm it. Yeah, it's like that. So this is inductive, observation to theory. This deductive, theory to the observation, and then confirm. Yeah, this is true. We'll get example of both the things. Right? And in deduction, if observation doesn't match, then you can say the theory is wrong. So in our medical research, we include both deductive as well as inductive. Somebody said it probably A because cost effect is so easily available for people. But newer molecule because it's cost effective, but we need not consider that point unless you talk at the beta error. Anyway, this was some point. So inductive and deductive, you are going from specific to general, general to specific, and then you agree upon or refute the theory. Now, in inductive approach, we'll get one example to make it clarify. Say the women tend to have a lower heart attack rate. That is one observation. Other observation, post-menopausal women have much higher heart attack rates. There's another observation. Third is postmenopausal women on estrogens tend to have a lower heart attack rates. These are the observations. And based on this different observations, collectively, we give one theory that estrogens offers a protection from heart attack. That is one of the generalizing theory. This is known as inductive approach. Now, deductive approach. That theory is that estrogen offers protection from heart attack. Then you do the experiments, control trials involving postmenopausal women, and then give few them estrogen, some you give no estrogen, etc. And you observe that estrogen provides no extra protection from heart attack. Then you say that the hypothesis is not substantiated. So inductive approach, you go observation to theory. Deductive approach, you go from theory to the observations and either confirm it or you refute it. And this goes the cycle, inductive and hypothesis, deductive approaches in medical research. But you will enjoy this provided you are doing at a few different places. Other example, green leaf vegetables consumption is associated with a lower incidence of lung cancer. Green leaf vegetables are rich in pro-vitamin A, and synthetic beta carotene reverses early pre-malignant changes in epithelium. These are the observations. So hypothesis says that beta carotene may offer protection from lung cancer. This could be the one of the observation leading to theory. Deductive follows inductive, inductive follows theory of possible. Both way it is possible. It's not that one precedes the other. It's possible depending on how you are doing observation. But when beta carotene may offer protection from lung cancer, and now you want to verify through the experiments, randomized control trials using beta carotene and placebo carrot studies that you are going to do it. And cancer incidence was higher among those who received beta carotene supplements. So conclusion is beta carotene may offer no protection from the lung cancer. So what what we are basically concerned with when you are doing some kind of the preparing a theory, etc., don't look at only 1 point or 2 points. As far few points, and if you want to do that few points, etc., what could be the answer? I will be going for the one exercise which all of you should be doing at some point of time. That is the we'll have an Excel file over here, and that is known as web of position and the web of effect. This, I would say that all of you should do one assignment, take a different topic, and try to do it at a later date. Web of position and web of effect. So you need to do it 5 times, ask the 5 times, and I'm sure at the top almost you will get the same thing. Let me make it a bit wider. Suppose I keep the center in the center one disease condition. Let it be keep simple disease like malaria inside. Then you ask the question, why malaria? And if it is a malaria, so what? So what? This simple looking exercise is marvelous for the aspirants of the research, epidemiologists, etc. So on one side, you asking the question, why malaria? So you can say that it can be because of the mosquito bite, infected mosquito bite, right? It's not a infected with falciparum vivax of uh, falciparum or vivax, right? Infected mosquito bite, right? And then other reason could be low immunity, right? Now, so you can ask again, why? Why infected mosquito bite and why low immunity? So your answer will be somewhere over here. There will be bifurcation of these two infected mosquito bites. Why infected? Because patients patient not treated fully. That's one reason. Why? Because then only mosquito will be able to take the falciparum parasites from somewhere or virus parasites. And second reason could be the breeding of mosquitoes. There can be three, four, five things. People are not using personal protective measures, so many things will come. But because of space of and lack of time, I'm looking only two or three things. Then third, again you ask why? Why patients are not taking full treatment? Why this breeding of mosquitoes? So you have something over here. Why patients are not taking treatment? Because doctors not explaining properly, or and then other could be their lack of medicine or lack of finance. So many things will come over here. Why breeding of mosquito? Because the water logging is there, and then no larvicidal measure like this. Okay, what it maybe you write down three, four, five things, right? Uh, I don't know why he's writing. Then again ask why, why, and you will have some answers over there. Again ask why. If you ask five times why and take a big chart paper, and then you will prepare the whole web of causation for that malaria, why malaria occurs. And then also try to answer, so what? Malaria hai to hai, let it be there. What's the problem? So you need to answer if there is a malaria, what is the problem? Then you may write that it will be burden on healthcare system, then it will reduce the productivity. It can lead to anemia. It can lead to the low performance in education and so forth, etc. Then you again ask, this looks very simple, but do it five times and then you will understand. So what? If there is a burden of on healthcare system, if there's a production is less, if there's anemia, if there's low performance in education, so what? Then because of anemia, you write down there will be more maternal death. Again, will be low productivity. You write down in the same lines. Huh? Because possibly I'm not doing it. Then the more quarrel will be there in the society, etc. મારું સેશન પતે એટલે ફોન કરો ઓનલાઈન સેશન પતે એટલે ફોન કરો મારું સેશન ચાલે છે ઓનલાઈન નીતિનભાઈ હું કરું છું ફોન 15 મિનિટ પછી for burden of health is what will happen, you will require more doctors, you will require more medicines, etc. So you write down all this point again, then go for so what? Five times you need to ask for at each level. And once you prepare this, if you have a team of 10 individuals, between two individuals, you take one disease, other two, other disease, and you will see that most of the at the fifth point of the why you will get something like illiteracy, lack of awareness, a lack of moral values, etc. And in so what at the end you will find that it will lead to the poverty, it will lead to the malnutrition, etc. And then you will be able to establish the vicious link based on this exercise. And based on such exercise, now you have access to the computers. You apply your machine learning or artificial intelligence or capability of analysis that if you are doing, let's say, for 1,000 disease and you have so many risk factors, find out which are the risk factors, you control that risk factor, and then you will be able to prevent the various diseases together. And not only that, when it comes to a few risk factors, what will be your strategy to control those risk factors? Which is the best strategy? There can be 10, 15 strategy to control those risk factors. At that time also we can use the matrix that these are the strategies, these are the risk factors which are affected, and how you can control with a minimum inputs, how do you get a maximum out. That kind of study is required for our countries like India. Then we'll have a lot of the advantage. Right now, the decision making process is taken by the politicians and not by the professionals. So, as a professional together, we should be able to find out that how we can maximize the result with a minimum input. I will give an example. You may give me the answer. Let's say I have 100 crore rupees for prevention of diseases in general. This is in general, right? Out of that, out of that, I want to use only for two purpose. One is immunization, immunization. Other thing is nutrition. Now tell me how much you will be using for immunization. If you say immunization, you will be spending 80%, then automatically nutrition is 20%. So you need to tell only that for immunization, out of 100 CR, how much you will spend. Give me the answer. For immunization, out of 100 CR, how much you are going to spend. This is a really thought-provoking thing, how you can arrive the solution, how you distribution of the resources you will be going to do. Any answer? You write whatever you want to write. 100 crore rupees is given to you. Let's say for state of Gujarat or state of Maharashtra, whatever you belong to, and you need to decide that how much money you will be giving for immunization, how much you want to give to nutrition. And let's see what is the answer. यार फिंगर चलाइए उसमें क्या है जस्ट 50% both wonderful, yes, wonderful. Then what next? Anyone? Modern nutrition, okay. What else? You write down the figure. Why do you write modern nutrition? Write down 60%, something like that. We are not going 80%, okay. What next? You try to say everyone in meeting, right? To everyone, right? 40% immunization, 60%, etc. Okay. Now, if someone asks you that give you a scientific basis of decision making process, in that case, this why and so what will tell you that the how you are going to take a decision. That how much if you spend, let's say 50%, 50 CR on the immunization, what you are going to get? You will be able to control 10 or 15 diseases at the most. While if you control the nutrition, if you do something on the nutrition, not only the 10 or 15 diseases will be get affected, but rest of the disease will also get affected. So that way you need to calculate and find out how much is to be spent for what. If I am the decision maker, probably I will say that 90% of the nutrition, 10% for the immunization, something like that. But anyway, this for the purpose of discussion, and you should be arriving with the data on your hand. So this is a web of causation and the so what analysis, and then uh, let me stop sharing it and let's me have some dialogue with all of you that in your day-to-day life when you think of some the disease or you take some problem, you do some kind of the research study, you try to write down epidemiological facts regarding that. You try to have a scientific inquiry for the purpose of research. Also, you prepare as much as possible how that problem can occur. Prepare, ask why 5 times or 4 times, and so what analysis also. And then you should be going for the analysis purpose. So, you have a group of 10 to 15 individuals, prepare a list of the problems and try to do this. Any other problem? Can you ask any question that will be enjoying much more?
Hello, sir.
Yeah, बोलिए.
As I am audible. Thank you for this information, sir. I have one small
Speak
question.
bit loudly. Speak bit loudly.
Sure, sir. Now I am audible.
Yeah, yes.
So I have one question. In hypothesis for quantity and quality, you just
Hmm.
say used to develop hypothesis and used to test the hypothesis. What is the difference between develop hypothesis? Mostly, I have doubt while develop the hypothesis. I,
Developing a hypothesis and testing a hypothesis both are different things. We take any questions. For example, right now, people are feeling like, let's say, in this season, the vertigo like thing is much more. Now we want to develop hypothesis. What could be the reason? So same people, but a different season, they don't feel vertigo. So most people feel vertigo during monsoon season. Then in that case, we should that what are the thing in monsoon? So you can say that the humidity increases. That means the relative oxygenation is less. If we find out such thing, then if our hypothesis is that low oxygenation in the monsoon leads to the giddiness or a vertigo-like thing. In that case, then we need to have the measure the oxygenation saturation in the air, oxygen saturation within the blood, because in the air it could reduce a lot, but in the body it may maintain because of the coping mechanisms. So if we can find out some proof, and in the same season, monsoon season, somewhere there's a rainy season at the same time, other place not rainy season. So different days are there, different people are there, different location are there, and you are doing study on 10,000 people. Based on that, then you arrive that yes, this could be the one of the thing that can lead to the vertigo in monsoon. Or according to Ayurveda, it is a mandagni leading to and arm leading to the obstruction in the blood flow that may lead to vertigo. That may be the Ayurvedic theory. But now, once we have developed this, in when we develop the hypothesis, now we want to test the hypothesis that whether it's true or not. In that case, then you take the area which is favoring the which favors and leads to the vertigo, and other factors or the areas it doesn't the follow the norms of that it will lead to the vertigo, and then you go on doing the cohort study, for example, and then you can find out that whether the theory was right or not. That is the testing of the theory. So that we develop and then we are testing the theory. You have written something in the PICO in study designs. It was mentioned in one of the slide. Uh, PICO. I will let you know. Okay. Anything else? Any other question? So the next assignment would be what we are going to do. All of you should uh, by now probably you have downloaded the Happy Info software, installed the software, and you should be able to work on itself. Before you try to use your Excel file, try to use its own file. When you want to use your Excel file, you need to select something like XLSX, and then you select your Excel file. We'll see the next time how to use the Excel file. You keep the data ready. Right now, I'm just telling you, first command of the AP info is read the file and give the file location. Where is your file is kept? Usually you try to install in the C drive. That will be much easier. Otherwise, if you give in some other drive, it will be making a problem for you in selection. In that, you select the project. Oswego. Here, what say the project means AP info. If you are taking one project can have many files. And so many files out of that, we can select one file for the purpose of analysis. So you try to select, read is the first command in APinfo, and then you want to analyze this file. So before you want to analyze any file, first thing what you should do, try to get a frequency. And if you write frequency star, it will give all the frequencies. Other thing is you select whatever items you want, right, for the purpose of analysis. If you select three variables, it will give analysis of the three things together, right? Then, if you want to do a cross tabulation, you can do like this. One thing is person eating jello and person felt ill or not. This is a table command. You are going to use it. So you start using FINFO, and before from the third the session, almost you should be able to use these three commands, right? The four commands: read, frequency, tables, and the means command. In this case, you can see the Jello 69% fell ill, and if not taken, 57% fell ill. What is the p value less than 0.05 or not? It is p is more than 0.05. It is not significant. This probability of event, p is the probability of event by occurring by chance. We'll see at the time of standard normal distribution curve. And if you want to use means, first select the variable which is a continuous variable from which you can find out mean, age, right? Is there any age difference for illness or not? Yes or no? So say that those who were sick, 39 years was the mean age, and no illness, 32 years. So older people were more ill compared to the younger population. But p-value says that the difference is not statistically significant. P is 0.2. So this APinfo software or read command list the frequency tables and means. This you should be able to use it. And you can use the help command also to learn any kind of the data you want to use it. And this will uh, teach you full APinfo, right? So many things in that. But the four, five commands you start with, and then you will love the APinfo, and you will get into more and more. So I will be stopping over here. Uh, stop this. So any question? So shall I close the session? And I hope that you will start asking the questions in uh, group also. One unanswered question I will find out and let you know. Thank you.